You're listening to Everyday Emergency, a podcast from Doctors Without Borders.
Hello, I'm Laura McCullough, and this is Everyday Emergency. In some places where MSF works, getting access to effective antibiotics is a matter of life or death. And choosing the right antibiotics to treat a patient can be critical. Antibiotics are the cornerstone of modern medicine, treating a vast range of infections, many of which MSF comes across in our work. But over the last few years, we've been seeing a troubling phenomenon in our projects. The standard antibiotics we're using to treat some diseases have simply stopped working. This phenomenon is called antimicrobial resistance, or AMR for short. And what this means is that some of the bugs that cause disease mutate and find ways to avoid the effective elements of antibiotic medicines. So what can we do when this happens? And what steps is MSF taking to try to tackle AMR more broadly? Today's guest is Muhammed Khalife, an antimicrobial stewardship advisor with MSF, and he's an expert working to counter this issue in MSF projects around the world. Muhammed helps staff identify the right antibiotics for the patients in our care, while not giving the mutant bugs any more chances to grow and to spread. Muhammed, it's great to be here with you. And I'm wondering if we can start by you drawing on your experience with MSF to paint a picture for people of what antibiotic resistance looks like and why, how it's so dangerous for people.
Yeah, sure thing. I think I can tell you a little bit about our recent experience in Afghanistan. So we have this newborn babies unit in Afghanistan where we were just starting an antimicrobial resistant program. And when we started with the program, we were shocked to discover that we had a very dangerous, very resistant bacteria that was actually all over the place. And, just out of a sudden, we discovered that we had like more than 6 babies, very frail newborn babies that were affected by this bacteria. The issue as well is like we did not have any affordable treatment that was available in our facility. It was a very rural area in Afghanistan. So we really had to be to consult with so many experts around the world, to just get some opinion, like what can we use? What could you recommend? Because it was a very critical situation, and we had babies who were dying. And we really needed to find some solution. Unfortunately, everybody was recommending very expensive antibiotic. We were talking thousands of pounds worth of antibiotics that nobody can afford to treat just one newborn. So we really had to use some the older treatments, and we had to be very daring in order to save the lives of those very frail little babies.
Did you manage to save all their lives?
Unfortunately, many babies did not make it. But by the time we got the treatment, we were able to save some lives. So it was not a very bad ending, but unfortunately, we could not save them all.
So there was at least some kind of solution, but it's obviously a very scary situation for a medical organisation and tragic for the families involved.
Exactly.
And what I find so interesting about antibiotic resistance is it has so many different faces. It impacts so many different people in different ways. It's not just a one face thing. Can you talk a little bit about other places where MSF is treating antibiotic resistance?
So I can tell you, for example, about our experience in Kinshasa, in the Democratic Republic of Congo, where we had a very quite big hospital for the treatment of HIV patients. And in this hospital, we have been using our MSF guidelines for a long time, and we have been seeing that they are not the antibiotics that we are using are not always working. So we thought there was a problem. And microbiology back in the time was not very commonly used. Microbiology is a diagnostic we use in order to see what kind of resistance we have in the bacteria. So when we started the activities there, we started seeing very huge number of a bacteria called Salmonella. Usually with Salmonella, we, in so many countries, we treat them with very simple antibiotics. But even, those simple antibiotics were not working in this hospital. And we really had to shift all our treatment guidelines in order to account for it, because those patients are very vulnerable. And we cannot wait until we get the results to treat those patients. We need to treat them from the start, because they were coming to us with very severe infection and in a very dire situation. So it did entail, because once we changed the guidelines, we needed to get the antibiotics that is needed. And we needed to train the nursing team, the physician, on how to use those new antimicrobials that they have never used before, and some of them could have some levels of side effects that they need to learn how to deal with as well.
Yes. And, I think listeners will be familiar with this bug, Salmonella. It's absolutely life-threatening in these kind of situations where, you perhaps don't have the antibiotics to deal with it. So, another situation I'm very interested in hearing about is where we're treating people with war wounds. Again, a very different kind of patient population. Maybe you can talk to us there about why antibiotic resistance is also a very critical issue.
As MSF, we really work in emergencies, and we do a lot of trauma care. And actually, the interest on antimicrobial resistance started when MSF started being involved in trauma care in the Middle East with the conflict. Because I can tell you specifically, for example, about Iraq, where after the war has ended in the north of the country, we were involved right away with a trauma hospital, and we started a reconstructive surgery hospital where we were treating patients with wound infection, bone infections. And when we started sending samples to the laboratories for those patients that were affected, we discovered that we had all kinds of resistance. So one bacteria called Staph aureus, it was almost like all of them were resistant to the first-line antibiotic. It was almost 100%.
That would be the standard antibiotic, just didn't work.
Exactly. And sometimes even like our last resort antibiotics did not even work. Although, like most of the patient, it was not about a death or life or death situation with this population of patient, but unfortunately, many of them, sometimes we could not find treatment for the very resistant bacteria they had, either because the antimicrobials that they need were just unaffordable, or we did not have the means even to test for those antibiotics.
So what happened to these people?
So some of those patients that did not have any treatment for their bugs, they unfortunately ended up with amputation. Imagine, like, some patient even had like minor cuts where, and those minor cuts that were not well cared of, and they ended up with deep infections that reached the bone, and some of them unfortunately would end up with amputation. Yeah. So it's definitely a very bad situation when we have such patient. And we really feel helpless because we cannot offer the patient many options, unfortunately. And we always try our best. We try to be as scientific as possible and look for and do as much as possible with what's available. But unfortunately, we don't always find the answers. I always try to treat my patient as I would like my patient, my family or myself to be treated. And we always try to do the best we can with what's available, but unfortunately, sometimes it's just not enough.
I mean, you've seen so many patients in so many places. Are there any that particularly stick with you, where this sort of sense of helplessness for you?
We did have a case that I will never forget. It was an 8-year-old who actually had just a car accident. You know, he had like a fracture, and it was a very bad fracture, if you want, very complex one. And unfortunately, he did not get the necessary care at the start. And the patient ended up with an infection. We treated this infection. He came back, and then he got a very resistant bacteria called Pseudomonas. And this bacteria, unfortunately, we tried to treat it with all the antibiotics we were able to afford, and unfortunately, it was never enough, and he kept having the infection. So in order to actually, for this infection not to progress even more, we had to stop it. And this 8-year-old, unfortunately, ended up with an amputated leg, you know, at a very, very young age. So it was a very dire situation. And it was very difficult to explain to the family, to the mother, and explain to this little child why we need to remove his little leg.
We have this vast challenge. Wherever we go, we see stuff. Let's talk a little bit about what MSF is doing to try to prevent and control this crisis. So perhaps you could talk to me a little bit in, either in the places you've worked or more generally in MSF. What are we doing to try to prevent the spread of antibiotic resistance?
Yeah. That's a very important question. I mean, prevention is a key. And in infectious disease, we always talk about prevention. And for us, one of the key programs that we start in most of our hospitals or clinics is what we call infection prevention and control. So infection prevention and control entails programs that make sure we keep the hygiene at high level in our
to keep the bugs away.
Exactly, and prevent the spread. If we ever get those resistant bugs in our hospital, to control them, to contain them, and not to let them spread to our patients, to not only our patient, but even to ourselves, to our staff, and to the community at large, to just make sure they are well contained through measures like hand hygiene, through cleaning, disinfection, even like wearing barriers, wearing masks sometimes, wearing special robes just to protect us from acquiring those infections and spreading them in hospitals and the communities. Not to forget also about vaccination. The more your community is vaccinated, the less they are susceptible to infection, and the less they will need antibiotics in the future. And this will decrease as well this problem of antimicrobial resistance, which is also very well driven by the use of antibiotics. So I cannot stress enough the importance of vaccination as a preventative measure.
Nevertheless, there are outbreaks of these resistant bacteria, and I guess it's pretty critical to understand what you're dealing with here. Can you talk a little bit about how MSF tackles that diagnostic challenge?
I always say that you cannot fight an enemy you cannot see. So the lab is really the eyes. It gives us the eyes to see what kind of resistance we are dealing with, what kind of bacteria we're dealing with. Obviously, not all the countries are facing the same kind of resistance, not the same type of bacteria. So I've spoken in my talk about many types of bacteria, and they're not all treated the same. And MSF is really a pioneer in the work on starting what we call a bacteriology lab in low and middle income countries. So we have our own approaches to make it as affordable as possible and as sustainable as possible for people to be able to do bacteriology activities in low and middle income countries. One of our inventions is Mini Lab, just a very simple way of starting a microbiology lab. So it's just it comes in 5 containers. And in this 5 container, you can start microbiology activities in just 3 months, actually. So this mini lab, it is really automated, and it really needs little training, and you don't need a dedicated microbiologist in order to operate it. I mean, another very important invention that came from MSF, really one of our prides, is called Antibiotic. So because we said that one of the main challenges with microbiology is not having microbiologists. And the solution is not to always have people from higher income countries to come and work as microbiologists in lower income. This is not a sustainable solution. So Antibiotic is an artificial intelligence that was created by MSF. You need to do the culture, and it's just an application that you download on your phone, and the artificial intelligence is able to do the interpretation of the result of the microbiology.
So there's already 2 things that we're doing. Now let's get on to your own role, because you fulfill a very important role in any team that's trying to kind of tackle antimicrobial resistance.
So antimicrobial stewardship is a set of activities that we start in a medical facility, in order to optimize the use of antimicrobials. Okay, so our goals are actually first the patient. So we want our patients to heal them from their infection, but at the same time, we want to avoid wasteful use of antibiotic. We want to avoid having patients suffering from side effects from antibiotic. And we really, one of our goals as well is to keep the costs low for all those activities. So we want also to decrease the cost while thinking about the best options for our patients. So patients are the focus. So when we say avoid wasteful antibiotics, so there is some tendency to what we call overprescription of antimicrobials. So some clinicians, even when we don't have real signs of bacterial infection, for example, they would go and prescribe antibiotics, just as protective. So why not? But this is a very harmful practice. The more we are prescribing antimicrobials, the more we will get antimicrobial resistance in the future.
Because it means that if the bad bugs learn how to avoid being killed by the antibiotic. Why do you think it's important for people listening to this podcast to learn a bit more about antibiotic resistance? And is there anything that we or they can do?
Antibiotic resistance is a collective responsibility. It's not only my responsibility. It is a responsibility for so many people at so many levels. So it does include any person listening to it. So listening to our podcast, because for me, we all have roles. For example, antibiotics. Okay, if I have a course of antibiotics, I need to finish it on time. I cannot just choose the timing I want to take this antibiotic for. And also our role is also for hygiene. Our role is also to keep our children vaccinated, and keep even ourselves as adults keep our vaccination up to date, and be aware of this problem, because it's driving, it can really lead to very serious consequences if we don't apply all the preventative measures. If the AMR situation is not tackled, really it will be very difficult in the future to treat our patients, and we would be losing patients for the silliest for the silliest of reasons. Maybe in the future, simple pneumonias that we treat with simple antibiotics nowadays could become very difficult to treat, and they will need antibiotics that are not available.
Thank you very much indeed. That's just been so interesting. I mean, both scary and exciting and inspiring.
Thanks a lot.
So that was Muhammed Khalife, an antimicrobial stewardship advisor with MSF. We hope you enjoyed the conversation, and if you want to find out more about the issues raised, just go to our website, msf.org.uk. This was Everyday Emergency. Thank you for listening.
For more true stories from the front line of medical emergencies, subscribe via your podcast provider or visit msf.org.uk/podcast.